you, Tina. You have no doubt heard today that a woman in her 80s has died as a result of COVID-19. I want to express my deepest sympathies to her family, her loved ones, and her friends. We have said so many times that this is such an insidious virus, and though we have done well here in our province to keep cases low, it's still here. So continue to be careful, respect public health guidelines, and again, my deepest condolences to the family. Now I'm ready for your questions.
Premier, you met with the Atlantic Premiers last night, and I understand there's an announcement coming later. Is there anything you could tell us specifics around what's been decided on the Atlantic bubble?
Yeah, what was new for me was the inclusion of Newfoundland, so we are talking about the Atlantic bubble now. Their cases have come down over time, and now they're down where New Brunswick is. So that will be mid-April, and I believe there will be a date released today.
What makes it the right time to do this?
The comfort of all 4 provinces and our advice from our chief medical health officers. We all needed to be on the same page, and we were looking at an April date, and that's where we all decided it would work.
Is there any difference in the way the bubble would operate logistically with borders from the last bubble?
My understanding is everything would be the same, but we'll get back to you if there's any changes.
And Premier, what is your, oh, go ahead.
I'm curious about the conversations around opening up to the rest of Canada beyond the Atlantic bubble. At what stage are those conversations?
I don't think we're there yet. It was briefly mentioned if we wanted to speak to it or mention it in the release, and we decided it wouldn't be appropriate at this time until we have further vaccinations out into the public.
And what is your hope in terms of the Atlantic bubble and the kind of movement across our borders? What are you hoping to accomplish with that?
Well, more normalcy, commerce, people being able to visit their friends and family. I think for a long time we've been able to keep our borders tight, and that's proven successful, and the previous Atlantic bubble was very successful, so I'm eager to see that happen.
But is this coming at the right time for you? Because you did say, I think, last week that it couldn't come soon enough, so you must be feeling pressure, building pressure from businesses. I mean, we're a year in, and they're biting the bullet most of it.
I don't feel any increased pressure since I've started in the job. I think that everyone has been wanting to see opportunities to travel throughout our region, and when you see that all of our cases are around the same level percentage-wise, it makes sense to me to start looking at it.
You're going to be starting some public budget consultations this evening, so of course you've got a good pulse on the financial situation of the province. How badly do we need the travel to start resuming between the 3 provinces as a source of income?
I think that we're in the best position of any province with our economic recovery. We're getting close to pre-pandemic employment levels, so that's encouraging, and a lot of that is credit to Nova Scotians for following public health guidelines. That's proven to be strong economic policy. We do have a budget that will be in a significant deficit, but it's not a structural deficit, so we'll be working at targeted investments where people need help right away, and then moving with a plan to get back to balance.
What do you hope to accomplish with your first budget?
Dealing with the immediate concerns in healthcare, I think that the pandemic has shone a light on some issues in our mental health and addictions. Addictions are on the rise. I've said that I'm worried about that with Nova Scotians, so you'll see some programming and targeted investments there. And long-term care is another area that I think there has been gaps exposed throughout the country and here in Nova Scotia. So previous to me, there was some investment there announced, and there will be more of that.
I know mental health advocates say that basically governments have applied band-aids to the whole issue of mental health, that it doesn't get near the attention that, say, something like cancer gets, yet it's growing in prevalence amongst the population. Do you think it's time for a rather significant investment, and is that what you plan?
I agree. I think that there is significant investment warranted, and that's compounded by the pandemic. That's why we created the Office of Mental Health and Addictions, and we're eagerly looking on how to fill a position that has expertise, a clinician background, to work with us. But there'll be some specific initiatives that the department came up with already that'll be in this budget, so that we have better, more timely access to mental health across the province.
So it's been said that 10% of the overall health budget should be directed towards mental health. Will we approach that goal?
I don't know about the percentage. I know last time it was less than $1 million increase, and it'll be substantively more than that.
Premier, Paraday Energy is asking the federal government for over $900 million in assistance. I realize the province doesn't have a say in that, but are you supportive of that Goldwater project? And if so, what do you say about how it will affect the province's greenhouse gas emission targets?
I am supportive. I think that it's important that we look at economic development in the province. I'm encouraged to see an agreement with the Mi'kmaq. They benefit from employment, and it does help the international community get off coal. I've said that was my priority as well in this province, so to help Germany and others with natural gas as we transition. There would be an uptake of carbon here in the province, but internationally it makes sense environmentally, and it makes sense economically for our province.
And the previous government issued some orders in council related to increasing biomass for electrical production. Will you continue down that path, or will you reverse that order?
I'm focused on renewable energy, mostly on the wind development side. That's the cheapest form of renewable energy. But wood heating is also another opportunity for us. That OIC has very limited impact to rates when you look at the inputs and outputs that go into the formula of rates. That impact's negligible, and it does support the forestry sector.
In terms of AstraZeneca, when will the province open up bookings for people who are not just 64 and 63 years old?
So we have another 13,000 coming in, and we know there's significant uptake on the first 13,000, but there's a lot of people in those age cohorts, so we want to make sure that all 64, 63-year-olds have that opportunity to make their appointment, and then we'll start descending down.
Okay, and in terms of, sorry, just one more on AstraZeneca. With the change in the guidelines and it's now being recommended for people over 65, will that change how Nova Scotia rolls out that particular vaccine?
No, it won't. It said that it's safe for over 65, but the recommendation is still for those that are older and more immunocompromised not to use that vaccine, is my understanding from Dr. Strang. So at this juncture, we'll continue with the plan to use the mDNA, the Moderna and the Pfizer vaccines for over 65.
Premier, back to Paraday for a sec. What conversations has the provincial government had with that company? Have they asked us for anything? Have there been any talks?
Not to my knowledge, certainly not with me. There hasn't been a financial ask. We look at it as a project. It was approved years ago for their permits, and we would not be submitting any financial resources to that project.
So if they asked, you'd say no thanks?
We would not be giving them any funds, no.
If vaccination continues to go well in Nova Scotia, could our herd immunity here affect our ability to open the bubble to the rest of Canada, irrespective of where other provinces are in their vaccination? If we're doing well here, could we see it open sooner?
Well, it's a question that would be best posed to Dr. Strang tomorrow. I think population immunity is something that is a consideration, but everyone's watching the variants as well, and that will also be looked at. And at this time, we haven't really discussed in any substantive way going beyond Atlantic.
Premier, I understand that vaccination rates and the conversation around opening to wider Canada is still far off. Can you tell me how much of a priority this is for you? I'm hearing from Nova Scotians who are concerned about having gone more than a year now without seeing their family, and are wondering if this is a focus at all.
Yeah, it is a focus, and I was the one to reach out to my counterparts in PEI New Brunswick to ask for the meeting that we had last night. That's where my advice was comfortable from Dr. Strang in public health. So that's the starting point. I think that we all should be cognizant that people need to see family and friends, but good public health protocol, the restrictions that we had in place, shutting down early and then cautiously opening back up, proved to work very well economically for our province. So that's what we need to continue to do.
Is there anything you can tell us ahead of the actual announcement coming out? Like, will Newfoundland be included in this bubble? We're not sure if we're going to see you again this afternoon. So.
Yeah, Newfoundland is included. It's an Atlantic bubble, and it is mid-April. My understanding is when we talked, it would be the latest April 19th.
Premier, you were sworn in, you and your government were sworn in you're heading to your first anniversary, or your first month anniversary.
Feels like longer than that.
What are the mandate letters? Why haven't they been posted?
Yeah, they're very close to being finished. We're looking at them. We're putting in my platform pieces, some of the priorities, and they'll be out, I would say, within a week. You'll have those, and they will be public.
There's the hunger striker is still outside of Province House now on day 11, I believe. That's a very critical stage for anybody on a hunger strike, probably nearing hospitalization. Will you meet with Jacob Fillmore?
His MLA has reached out to him. Minister Diab had a conversation about the priorities of our government in this session and making progress on Leahy as we transition to ecological forestry. I very much appreciate the passion that this individual has, and I think a lot of Nova Scotians have for our natural environment.
Can you just explain why a moratorium isn't something that's a possibility or under consideration?
Well, we've made progress already. We went from previous governments mandated less than 5% retention when clear cuts took place. Now we're upwards of 30% retention. That has an impact to forestry companies, and I think that we all benefit from the forestry industry. It's an economic driver for rural Nova Scotia. We use the materials from the sector, so we need to work hand in hand with the industry as we transition and we implement the whole report, not just one part of the report.
What do you think of what you're hearing from some woodlot owners about the overreach in their mind of the Biodiversity Act?
I'm listening to them. I think that it's important that we hear that concern. When I introduced the Act myself 2 years ago, I said the focus would be Crown land and then voluntary participation with private land. So there are some concerns around the emergency order, fines, and the Act was never designed to be punitive. So we're reviewing those concerns. The last thing I want to do is burden landowners, and I want to work with them. So we continue to listen to their concerns, and I'll discuss those matters with my caucus and the minister.
We'll take 2 more questions from the room if you've got it, and then we'll go to the phone lines.
Premier, you just referred to natural gas as a transition fuel. Environmentalists would very much disagree with you. They'd say that's dated language to begin with and more corporate PR than reflecting reality, especially given the lowering cost of renewables. Might you revisit that opinion?
Well, I think that's debatable. I'm focusing on renewables where possible, so wind, solar, you're going to see a lot more on our grid. But the reality is coal is the most carbon-intensive fuel to be burned. It has more particulate matter, mercury, and so on down the line. That's why Canada has been working to get off coal. That's why I want to get off coal 10 years earlier. So this facilitates the world getting off coal, and I think it's a very important environmental initiative to be part of, and it impacts our economy here and allows us to bring in more revenue to spend on fighting climate change, transitioning to electrifying our transportation system, bringing our buildings to net zero. So I acknowledge there's differences of opinion, and natural gas is something that is cleaner than coal.
We'll go to the phone lines now. We have a question from Sarah Ritchie from Global. Go ahead, Sarah.
Hi, Premier. It's been 11 months since the deadliest mass shooting in modern Canadian history. If this happened again tomorrow, what has government done to make anything different?
So we are approaching the year anniversary of that awful scenario that took place in Portapique, and obviously that's a concern for all Nova Scotians, and we need to work obviously with our stakeholders that are involved in police enforcement, our emergency center, so they have access to that. There's so many things we can do, I believe, and there is an independent inquiry that will go over everything from top to bottom that involves different levels of government. I'm very eagerly awaiting the recommendations from that, so that we can make sure that a tragedy of like that never happens again in this province.
Sarah, do you have another question? Go ahead, Sarah.
I do, yeah. You just mentioned there are so many things we can do, so many things, in fact, that you and your government have the power to do. Why are you willing to wait until November 2022 to get those recommendations to make changes?
We're not waiting. We have an act before the legislature right now, Sarah, that deals with impersonation of police officers, so that we make it illegal to have that memorabilia and the decals and things that would allow someone to impersonate an officer. We will look at all opportunities that we have to improve public safety, but the inquiry is part of that.
Thank you very much. We'll come back to the room for one question. Jean, did you have a question? No, nothing? All right. Thank you very much, Premier.
Okay. Thanks, everyone.